can say, hey, it's their fault. But sometimes it's the system as well, because they don't have the time to explain stuff to you. They don't have the time to have conversations with you. Why? Because they need to get you in and out.
And they have a certain period of time where they can have you sitting up in that seat.
Yep.
And all of it's controlled by who? It's the same people that are controlling it.
Yep.
Same people that control the medication. All the same thing.
Yeah.
And what you're talking about, the system, because like my son was in London, and all the packages and foods, the government will not allow certain foods to be dished out to their people in London. Out here, you can have anything you want.
It's banned in other countries.
Because they know that's their money. It's like a cash cow. They're feeding you all this junk and salt and everything, Twinkies and whatnot. And so you think about it, why in a different country that they understand that and they will not allow that for their people. But out here, they're like fair game, you know, and then you get sick and then they say, here, we got this pill for you.
Because they're not monetizing there in other countries healthcare. A lot of times in other countries, the healthcare is free because it's monetized healthcare. Why would we take this stuff away that makes you sick, that makes us money? They're not going to do it.
You know what? It's Dr. Jones.
So we have to do it.
Dr. Jones, who I talk to every Thursday about this very thing, she said when she went to medical school, she said it wasn't even a class. She said it was probably about a day training about your what you eat. What do you call that? About
nutrition.
Nutrition. A day class. 1 day class. It wasn't even a semester. 1 day class about nutrition. So one of the things that she says is that she was a physician. She's working. She's overweight. She got diabetes, and she's just thinking that's part because they don't learn. Everybody else is overweight. All the other doctors is overweight. They're doing the same thing. She's taking medication, and she realized this ain't right. And so she just took all of that out, and she started eating better. She became a vegan, and everything changed. Her blood sugar, her diabetes went away. She lost 30, 40, 50 pounds, I think, maybe even more. But it was all that. And so you got to think about, you're talking to people and you're dealing with people. Somebody said that they try to figure it out. Doctors are practicing. They don't know everything.
Right. And
if they only had a 1 day nutrition class when they went to medical school, it lets you know that they don't know the fuck that they talking about and what we should be doing to heal ourselves. It's crazy.
And when you're under stress, like when, I was working a lot and all that stuff, you're not thinking, you want to comfort food. You want to feel good. You want that dopamine, you're right, that hit, and so that's another thing we have to, figure out for ourselves that, we understand that we're trying to comfort ourselves, but at the same time, we have to be more healthy. And when you say vegan diets or whatnot, that's fine. But then we have to, when people are under a lot of stress, particularly going into corporate, working for corporate, you're trying to soothe yourself.
Right. That's true. We're going to take a look at this other video and talk about it.
Healthcare is sick care. They're there to take care of the sick. I'm not talking about the hospital workers. I'm talking about the medical system in America. I'm talking about big pharma. I'm talking about those people that are trying to keep people sick. No cure should come with a side effect. No cure should come with a side effect.